Of course, I've experienced bullying. I feel like every nurse has, and most likely if you become a nurse, you will too. If you're new here, my name is Joy and I'm a neonatal nurse practitioner, and I'm just getting started on my nurse practitioner journey. I just moved to Houston and I'm going to share with you guys my journey. Today, I'm going to talk about nurse bullying. I feel like people have been discussing this for so long, but things happen every day and this topic comes back up every day. When people are talking about nurses and people becoming nurses, they talk about the bullied to nurse pipeline that you hear about. So the theory behind that is a lot of times those high school bullies tend to gravitate towards the role of nursing, and therefore you tend to find bullies in that profession of nursing. I can only speak to you from my own personal experience, and of course I've experienced bullying. I feel like every nurse has, and most likely if you become a nurse, you will too. So in this video, I'm just going to give you some tips on what you can do when it comes to bullying and what you can look out for. You want to start with going to the person directly and just asking them, like, can we talk? Whenever somebody's having microaggressions with you or bullying you, you need to address it in the moment in order to be able to move forward, because otherwise it's just going to fester. Every day you're going to have to deal with that. So I would just start by going up to them and saying, hey, Kim is our fake bully. Hey, Kim, can we speak for a minute? And then I'm sure she's going to say, okay, yeah, sure. And then when you guys go off into the room, just let her know, like, hey, the way you're speaking to me, it is making me feel uncomfortable. To be honest with you guys, I really feel like you need to have a backbone going into nursing, because not only will you be standing up for yourself, but you'll also be advocating for your patients. And a lot of times you're going to get pushback. So when I'm talking about advocating, I'm talking about, I take care of babies. So if I feel like I am concerned, or if I feel like an action needs to be taken and my voice is not being heard, or the parent's voice is not being heard, I have to be able to speak up. I have to be able to advocate for my patient. And not saying that the doctors or the medical team won't listen to you, but just saying that sometimes you have to be a little pushy to get your point across. In nursing school, they will talk about advocating and they will talk about delegating. So you will have to learn those two roles. Those are two big things that you'll have to learn as a nurse. Sometimes it's not what you say, but it's more of how you say it. So a lot of times people forget that when they're speaking to somebody, and then therefore is taken as, coming off too strong or being a bully or, being disrespectful. So I'm going to give you a couple of little scenarios of what happened with me and why I felt like I was bullied. So when I decided to become a nurse practitioner, I was so excited about it, but I wasn't really telling people that I wanted to be a nurse practitioner. And I honestly feel like the nurses that were in the unit that have been there for a long time, maybe been a nurse for years, were not excited for me. And little things were said to discourage me and make me feel like I wasn't good enough or ready to go back to school. So that will definitely happen to you. Nurses will tell you that you need to be at the bedside longer. You're not ready. Those kind of statements will happen. You got to be strong. You got to stand up for yourself. You got to know what it is that you want, and then you got to just go get it. Not everybody is going to support you in your journey to become a nurse practitioner or to become an RN if you're an LPN, or, to become a nurse if you just want to get started. So you got to be able to stand up for yourself and not let things affect you. Like, let that roll off your shoulders. Whenever she said that to me, my feelings was hurt because I looked up to her. She's a very strong nurse, but at the end of the day, girl, bye. And now look. So that's what I'm saying. Do you get past all of that? Not all nurses that are senior nurses are going to be mean. I definitely have a lot of senior nurses that I look up to that have my back and give me good advice that I can come to all the time. I'm advising you to find you somebody in your unit who is like that, who is your person. I have a couple people, but I definitely have some strong nurses that have been in the game for 20 years, so I can go and ask them how to handle things and, you know, what I should do moving forward. So number one, when you get in the unit, find you somebody that is more like a mentor to you, who you like, yeah, I mean, I want to be like her, you know, find somebody like that. And if she's willing to be nice to you and she's willing to mentor you, give you advice, I would say you need to take it, because it's always good to have somebody who's been doing this for a while, looking out for you and giving you the words that you need, because sometimes we don't really know what to say when we feel like we're in a situation. So another scenario, I felt like my manager was like not being a good manager, being a bully. Yep, I felt like she was being a bully, and I didn't really know what to do. So you know what I did? I went and found my mentor. I went and found that nurse who's been here in the unit 20 years, and I asked her, what am I supposed to do? And she gave me the best advice. And because of that, she wasn't my manager anymore. I got a new manager. I loved my manager. She was looking out for me. I didn't have no more problems, because your manager can really break or make you when you become a nurse. So it's important to have a manager who is looking out for you and not trying to destroy you. Those are my two situations where I felt like I was bullied. I'm sure it was other situations, but those are the two main that come to my mind. And I just want to give you guys a couple tips on what you can do if you feel like that's happening to you. So tip number one, I already told you what you need to do is have a backbone. If you're going into this profession, you need to have a backbone. You need to be able to speak up for yourself, and you need to be able to speak up for your patients. That's the most important thing. So if you that person, like you feel like, I don't like confrontation, I don't like going up to people and, you know, confronting them about situations, I'm gonna tell you what you need to do. I'm not that person, because if I feel like I'm being wronged, if I feel like something's not right, I'm going to the person. I'm going straight to the person who I feel like got me messed up. And then I'm just going to talk to them about it. I'm going to let them know how I feel. And I'm going to let them know what's going to happen if the behavior continues. That's just who I am. But again, I told y'all, I got a strong personality. But if you're that person who feels like, I don't like to confront people, that's just not who I am, I get it, girl. Everybody, you know, do things differently. The first thing you need to do is follow your chain of command. Y'all know in nursing, we have a chain of command. You know what I'm saying? My unit, I had a charge nurse. So I could go to my charge nurse and, you know, she can advocate for me or speak up for me. If that doesn't work, you can go to your manager. So I had a direct manager that I reported to. My manager was great. We had a great relationship, so I could always go to her and talk to her about anything. But I could go to her and then she could like bring in the other party or just communicate what's going on and just talk about like each person's perspective and what we can do moving forward. And then if you can't go to your manager, then you go up past her. But you need to continue to go up the chain of command. When I had my problem with my manager, my next step was to pull in HR. After that, she wasn't my manager no more. We are all grown women mostly, but there are men in this profession. So we are all grown adults and nobody should be getting bullied. Like, this is not normal. So don't let nobody do it to you. You like, stand your ground. Do either way, if you're gonna go to them directly or if you're gonna go up your chain of command. But what you need to do is shut it down, because the longer you let it go, the bigger the problem. Okay, the bigger the problem. Number two, you should always make sure that you have your stuff together. Don't give people a reason to hate on you. Make sure your report is clear. Make sure you know the information about your patient. If you don't know it, look it up. Make sure that you asking questions. If you're afraid to ask questions, that's a problem. In nursing, you need to be able to ask questions. Find you one person and not the person that started with you. If you are a new grad, do not go to the person you started with and ask them questions. You need to find somebody who's been in the unit for a while. Ask them questions and make sure you looking stuff up. Take responsibility, own it. It's your role. In the NICU, a lot of things was brand new to me because as a new grad, you, number one, haven't taken care of patients, so you don't really know the role yet. And then also in nursing school at my program, they didn't really teach us like how to take care of premature babies. That wasn't even a topic. And so everything I learned had to be on the job training. And so I saw a lot of things that I had never saw before, like once I actually started. So a 22-weeker, I'd never seen a 22-weeker before. In nursing school, they don't teach you how to take care of a 22-weeker. An oscillator, I've never seen an oscillator. A ventilator. You know what I'm saying? Like, I did not know any of these things until I started in my unit. So all the time I just felt dumb, and I felt like I was behind, and I felt like I should know. Listen, you're not going to know. You're just not going to know. So in order to move forward, what you need to do is own it. Take responsibility. There's a great neonatologist on here. She has a YouTube channel. Her name is Tala Talks, and I watch her videos to get through my nursing program. And I suggest you do the same. As a new grad starting in the unit, if you're going to be in a NICU, you definitely want to watch her videos, because she goes over all type of diagnoses that you might see and, workflow. So it would be great for you to use that as a resource. Just because you have the job doesn't mean you stop learning. You always have to be learning. Nursing is a continued learning experience. So keep that in mind. And like I said, when you're on the floor, make sure your report is good. Make sure you're asking questions. You're not just waiting on somebody to tell you what to do. You need to step up. This is a profession where we are responsible for our patients. When it comes to nitpicky stuff, like how many kids do they have, and is the mom and the daddy divorced type questions. Like, girl, I don't care about that. If you really want to read about that, pull up the social work note, okay? And you're going to have to tell people that. Girl, I did not look that up, but you know what? Go ahead and look that up in the social work note and look at them serious like this so that they know you ain't playing. Sometimes nurses want to, be nitpicky. They want to just be on your back, like asking you questions. I don't know that, girl. But if it's about your patient, you should know it. And if it's pertaining to the care that they are about to provide, you should know it. So how I handle those behaviors is I directly approach the person, and I just let them know, like, the way they're treating me or the way they're talking to me is not helping me learn. It's not helping me learn. So in order for me to learn, I'm going to need them to approach me a little differently. And I think when you just say it clearly like that to somebody, they get the point that it's not helping you with your learning experience. And if there's any feedback they can give you, great, but can we just maintain this in a professional manner? And at a time when you're trying to maintain being professional and, not getting in trouble for having conflict with a nurse who is a senior nurse in the unit, it's really hard to get through that. It makes it really tough. So I do understand. I have been there. I know where you are. And we all started as new grads. So give yourself some grace. Like, understand that it's not you. It's really them. It's really them. And if they are being mean to you, it don't got nothing to do with you. Personally, if you are doing those things that I said before, which is knowing your patient, knowing the information, and asking questions, there's no reason for anybody to be mean to you in this field. Like, if a person is afraid to ask questions, that's dangerous. That's very dangerous for our patients. I always take it upon myself to try to be a mentor and look out for new nurses coming through in the unit. And hopefully there'll be more people trying to do that, especially with all this talk about nurses being bullied. It's always been around. It's always been a thing that nurses eat their young. And I guess it really just depends on what unit you go to. In the ICU unit, a lot of nurses are type A personality. We like things the way we like it. And so you may come into the position feeling that way, and not feeling supported, but you have got to speak up for yourself, and you got to figure out a way to find those words, because this is your career and this is your license. You worked really hard to get here, and it's up to you to keep it. It's up to you to maintain your happiness. And again, like I always say, you are not a tree. You are not planted. So if you're not appreciated, if you feel like you just can't deal with this, leave. Get up and go. Do not let nobody steal your joy and happiness. It's not worth it. There's other hospitals, there's other units, there's other floors. There's still going to be bullies there. So you're going to have to figure out a way to maneuver through that. But you don't have to put up with toxic behavior every day at work. I'm really big on giving people the benefit of the doubt. So really, you know, the first time you cross me, I am going to think, okay, maybe she's having a bad day. I don't really know what's going on in her life. I don't really know what's happening. Obviously, you shouldn't be bringing it into the workplace, but we are human beings. So home life can get carried into the workplace. So first, I'm gonna give you the benefit of the doubt. But if it continues to happen and it's something that's happened more than once, more than twice, you're a bully. You're a bully. And so you got to be called out. I don't know what it is, but it's something about it. Once you confront the bully, we can just move forward, okay? Confront the bully. Tell them how they make you feel. Tell them that it's not helping you with your learning experience. And if there's any feedback they can give you, great. But can we just maintain this in a professional manner? We are all human. I know that behavior from senior nurses can really be hurtful. I'm a crier. So like when I'm mad, I really cry. And that's how I express myself. But at work, you know, you can't be doing all that crying. Number 3. Or is this number 4? I don't know. I forgot. It's hard to keep track. But make sure that you're documenting what is going on. If something is happening, send an email. Even if they don't respond to your email, at least you have your email with the timestamp on there stating what it is. So when I had my meeting with my manager and I didn't really like the way that things went, I responded back with an email letting her know that I wasn't happy with the results and I would like a follow-up meeting with HR included. If this comes up, you need to pull out that employee handbook, read over it, and know how to handle bullying situations. Most institutions, if not all, have a policy on bullying, anti-harassment and bullying. And so there are steps you can take, and those steps are in the handbook, going up that chain of command, starting with your charge nurse manager, and then including HR in that. My final tip is just going to go over how you treat yourself. Be kind to yourself. Self-care is very important. If you are experiencing these rough times at work, just know hard times don't last. So leave that workplace, get in therapy. That was something that really helped me when I was dealing with my bully at work. I would go through scenarios with my therapist and how to handle things, and that really helped me, and it took like a lot of stress off of me, because when you leave that job and you go home, you take that with you and it's rough. So when you're in therapy and you can talk to your therapist about those things and work on strategies and communication skills that will help you deal with that bully at work, that's a really big deal. So just remember, be kind to yourself, practice self-care. That's very important. This is the last thing I'm going to say about this. If you did experience nurse bullying, or you are currently experiencing nurse bullying, make it your mission to not do that, to not be that. If you see a nurse struggling, just reach out and try to help her. If you see a nurse that's not very confident, reach out and try to encourage her. Be a friend. Be that person that you needed when you was going through this situation. And also speak up for people. If you see somebody just being mean to somebody for no reason, ask that person, why was you talking to her like that? What was the reason? Because now you're experienced, now you have years, now you have a voice, now you know how to use it. So be that person for that new nurse. Be that person. All right, y'all, that's it. That's the end of my video. Just a few words of advice for you new grads and people who are thinking about becoming nurses. Just to let you guys know, if you like my shirt, you can purchase it below in the Etsy shop link. I will be making videos about nurse content and Houston content coming every Monday. So if you guys like this video, see me again next Monday. Thank you for joining me today, and thank you for staying to the end. See you guys later. Bye.